Hello guys, welcome back to my channel. My name is Denis. I know it has been a while since we interacted with this channel. For a couple of days, you've seen different health professionals and I'll keep bringing more of them. So if you have any problem, you can always comment in the down below here in the comment section. Any concern and we'll respond. Continue supporting us by spreading our messages and also subscribing to our channel. So today I want to talk about 3 different terminologies: cardiac arrest, heart attack, and heart failure. So recently we lost the former CS, Professor Mogoa. He died of cardiac arrest, and you may wonder, what is cardiac arrest? How can I identify someone has suffered from cardiac arrest? Because if you're not in a position to identify, then you lose that person almost immediately. Cardiac arrest is an electrical phenomenon where there's electrical disturbance in the heart muscles. Like any other muscles in the body, they need electrical impulse to be able to work properly. And heart muscles are not different. So we have electrical impulses generated from the sinus node in the heart. So these electrical impulses, they help heart muscles to contract and pump blood in our body. So when there is disturbance in electrical conductivity of the heart, then you suffer from what is called cardiac arrest. So in cardiac arrest, your heart completely stops to function. And that is serious, because when your heart completely stops to function, then in a few minutes, in 4 to 5 minutes, you'll die. Because if your heart is not able to function, that means blood will not be supplied to the brain. And blood not supplied to the brain, be sure that if nothing is done immediately, you lose your life. So if someone suffers from cardiac arrest, what will happen? These people, they will collapse suddenly and become unconscious. So even if you tap them and call them by their name, they will not respond. So cardiac arrest can happen in a normal heart, and mostly it happens in people with heart problems, like heart attack, heart failure, and different heart conditions. The way I've said, it can happen in perfectly normal people, healthy people. Like recently, in the last Euro, where Christian Eriksen, for football lovers, Christian Eriksen almost lost his life because he suffered from cardiac arrest in the field. He was healthy and collapsed. So any of us can suffer from cardiac arrest. Why not for a quick intervention by the players and even the doctors could have lost Christian Eriksen. If you have heart problems, like heart attack, you've suffered from heart attack, you have heart failure, or even in your family, there are people who have suffered from heart conditions, then you are also at risk because of the genetical predisposition. And also, if in your family there have been unexplained premature deaths. For example, someone you go to sleep, someone who was perfectly healthy, and then you don't wake up the following morning. You might wonder what has killed the person. It could be cardiac arrest. Like I was saying, an athlete who is perfectly healthy collapsing in the field. So if you are under that aspect where you've lost people, very young people, and where you can't explain the causes of their death, then you could be at risk of cardiac arrest. But any can be at risk. But remember, we have those who are at higher risk than the others. So that is simply what cardiac arrest means. As an individual, you have a role to help. What can you do? First, if someone collapses, maybe in the public and you are around, you try to identify if it is cardiac arrest. You tap the person as you shout the name. If they don't respond, you suspect that it is cardiac arrest. So as a first response, you should be able to know, we have basic life support. You should be able to do what is called pulmonary resuscitation, CPR, where you put this palm on the center of the chest and compress. So in our next subsequent videos, we will demonstrate practically how to do a CPR to be able to save someone from cardiac arrest. Secondly, as you do that, you have to call health professionals and inform them that you suspect of cardiac arrest. Remember, we have external defibrillators. They normally help also to resuscitate someone who has suffered from cardiac arrest. And our next terminology is heart attack, or what is called myocardial infarction. So heart attack there is inadequate or blockage of blood and oxygen flow to the heart muscles. Remember, the heart muscles are being supplied by the coronary heart arteries. So this one happens to the maybe a section of the heart or part of the heart. When there is a blockage of the coronary artery, it can be blocked by fats or cholesterol or any other substance in the heart. So blocking this coronary artery will prevent blood flow to the heart muscles, and you will suffer from what is called heart attack. So these people, they normally experience that severe chest pain, that sudden onset of chest pain. The manifestation of heart attack and heart failure is different, and also different from cardiac arrest. Let me come again very clear. In heart attack, you have blockage of blood flow to the heart muscles. That is a blockage in the coronary artery by fat, cholesterol, or any other substance. And then finally, we have heart failure. So heart failure is the inability of the heart to pump adequate blood to the body. So in this case, your heart is very weak or can be stiff, so that blood is not pumped adequately to your body. So it means that there will be retention of blood in your lungs, there will be poor venous return from the peripheral, and you'll manifest with different problems. Remember, we have different types of heart failure. We can have right-sided heart failure or left-sided heart failure, or both. And nowadays, it is called congestive heart failure because it is associated with accumulation of blood in the lungs. So with these people, we have blood accumulation in the peripherals causing edema. We have chest pain, we have dyspnea, we have coughing because of accumulation of blood or fluids in the lungs. That is the difference between heart failure and heart attack, and also cardiac arrest. I hope this information will help you guys differentiate the terminologies, and also assist in any case you've seen a friend, a family member, or any stranger suffering from these problems. We advise you that regularly you go for checkup, you monitor your blood pressures, you see a cardiologist, so that we prevent such problems. Remember, even if you have a heart problem, there are different ways of helping you improve quality of your life. Thank you guys for watching this video. Hope you learned something, and help me spread this message. Continue supporting me by subscribing to this channel. Keep it locked. Until next time, may God bless you.